My name is Sergeant Gus Proctor with the Charles County Sheriff's Office. I am the Law Enforcement Torch Run, Special Olympics Maryland coordinator. The Law Enforcement Torch Run is a worldwide movement to raise money and awareness for those in our community with disabilities. Since 1986, here in Charles County is when we started our chapter. We host numerous fundraisers throughout those years, Tip of Cops, Cops on Rooftops, the Torch Run t-shirt sales. Charles County has led the entire state for the past 12 years. We are coming up on $500,000 in t-shirt sales since 2006, which I think is very impressive. The money raised through the Maryland Law Enforcement Torch Run, it allows those in our community with disabilities to participate in year-round sporting events and training free of charge, and that's the key, free of charge. It does not cost their parents or the athletes any money to do any type of participating in any type of sporting event. Our torch run this year is going to be held on October 23rd. Of course, with the current situation with the pandemic, we can't have the normal 1,000 people that we have yearly. So October 23rd, we're going to have a small run with about 20 to 25 participants. We're also going to have a virtual. So if you can't make it, you can still support this wonderful cause by purchasing one of our Torch Run t-shirts. You can also go on our website, somd.org, under the Special Olympics Maryland site. You can also make monetary donations there. Here in Charles County, if you want to volunteer, you can contact the Charles County Special Olympics as well. Again, since 2006, I've been the coordinator. I appreciate everyone's support, especially with our Torch Run t-shirt sales. We're coming up on $500,000 raising our Torch Run t-shirts, and I just think that's incredible.
There's good news from our Department of Community Services housing program. Look for upcoming podcasts where we share our news and talk about the program with special guests. To listen in, visit podcast.charlescountymd.gov. Listen in your home or on the go.
Hi, I'm Renisha Miles, your Community Engagement Coordinator with Charles County Government, here to remind you to register to vote. The deadline is fast approaching, and we want to make sure all of our residents are registered to participate in the upcoming general election. So don't forget to register to vote. Check out the information on our Board of Elections webpage for instructions on how you can get registered. Also, don't forget to request your mail-in ballot if you would like to vote by mail. There are also early voting options in many locations throughout the county. So if you'd like to vote in person, that is always an option for you as well. So register to vote, request your ballot, or vote early. Don't forget to participate in the upcoming general election.
My name is Dianna Abney. I am the Health Officer for Charles County Department of Health. So as you know, COVID is still among us and flu season is approaching. So let's talk first about COVID. You all know that COVID symptoms are flu-like symptoms, fever, sore throat, cough, and those kind of symptoms. So first of all, let's talk about what you should do if you feel like you have COVID symptoms. You should isolate yourself, talk to your physician, and get tested. Also, you should remember to prevent yourself from getting COVID and to prevent spreading it should you get it to others. You should wear a face covering or a mask to make sure that you're not spreading germs to other people. And in addition to that, you should get tested if you think you have symptoms. Also, it's a good idea to get tested even if you don't think you have symptoms, because that helps us figure out what the positivity or what the amount of COVID is circulating in our community. Now let's talk a little bit about flu. Again, similar symptoms. And since flu season is approaching, one of the most important things you can do is to get a flu vaccine, because flu vaccine helps protect you from the flu. By the way, starting in October, the health department will be offering flu vaccine at our clinics. They'll be a little different this year. Rather than coming in and walking in, they'll be drive-up clinics, and you should be hearing more about that on the news in the near future. So I am returning to you as the health officer. I was a health officer for almost 6 years before. And I had a break of 2 years, or almost exactly 2 years, I had a break of. I like serving people. I mean, I'm a physician, I'm a pediatrician. That's kind of what we do anyway. And when there was a need to come back, I took the opportunity to do it. I love Charles County. I've worked here for 25 years, actually a little more than 25 years. And I love the community, I love the residents, and it was an opportunity to give back to what I consider my community. Even though I'm the health officer, I'm still a practicing pediatrician. In Maryland, if you're a health officer and a physician, you are allowed to still practice as long as that practicing doesn't interfere with your duties as being a health officer. So I see patients 3 days a week for a couple of hours before I start my practice here at the health department. And people ask me sometimes, well, why did you want to be a health officer? And I said, well, when I was a pediatrician, I got to take care of and make a difference in the health of 20, 30,000 people in Charles County. But as the health officer, I get to make a difference or help make a difference in the health of the entire county. And part of what I really like doing and what I did before was make sure that my staff gets credit for what they do and that people understand that the health department is not just where you get a flu vaccine, although it's flu season and it's time to get your flu vaccine. But the fact that you can go and safely eat in restaurants, the fact that people's septic systems and wells are safe has to do with our environmental health department and the work that they do. The fact that you do get those vaccines, the fact that there's some reproductive health care given for women who need it, the fact that there's dental care given for people who need it or choose to get it here at the health department, the fact that there is screening for breast cancer, and the fact that we have HIV services, that's all done through our nursing department. The fact that there are people who have disabilities, developmental disabilities, that get services and are helped to get jobs and things like that is taken care of here at the health department. People who need to understand or need to get some teaching about healthy lifestyles to prevent diabetes or to help them manage their diabetes comes out of the health department. So there's a lot more that we do than just flu vaccine, and we want to make sure, or one of my goals is to make sure that the health department is seen as a place that is for everybody in Charles County, not just one or two, or not people who are in need, but everybody in Charles County benefits from the health department. Like I said, it gives us a chance to serve the entire county, and it's not one person. It's this entire staff who works tirelessly and is very committed to serving this county.
Applying for jobs with Charles County government is now easier and more efficient. Visit www.charlescountymd.gov for more information.